A 35-year-old man comes to the emergency department after being in a motor vehicle accident. Internal bleeding is suspected. Which of the following is the best measurement for rapidly determining the patient's volume status? Choice A, skin turgor. Choice B, urine output. Choice C, Glasgow Coma Scale. Choice D, hematocrit. Choice E, heart rate. I'll wait 5 seconds and answer the question. So this is one of those questions that is actually really easy, but a lot of people still miss it because they overcomplicate things for themselves. When we're learning about the different forms of shock, most instructors will tell you to think back onto what is the root cause of the shock and then go out from there. And that's exactly what we're going to do here. So of course, in this case, we have bleeding, which leads to hypovolemic shock, which leads to decreased cardiac output. So in an acute setting, the first compensation you'll get, or one of the easiest to measure compensation effects, is tachycardia. So choice E, heart rate, is the correct answer. Now, first we can cross off some of the really obviously wrong answers. Choice C is just unrelated. And even if you want to make some argument about maybe the Glasgow Coma Scale would be affected, I mean, it's so non-specific that it's not useful. Choices B and D are not useful in an acute setting. Obviously, urine output, like we don't have time to collect urine from a patient who's experiencing hypovolemic shock. And it takes time for urine output to decrease anyway. Hematocrit can actually be deceptive because in an acute setting, when you're bleeding, you're losing whole blood. So your hematocrit might actually be normal before your body has time to compensate using the ROS system or ADH to reabsorb fluid back into your body, which is what will cause the hematocrit to go down, which is to say the concentration of RBCs, because you're diluting what's left of your RBCs. And skin turgor might be an answer choice some of you chose carelessly, but it's really just that skin turgor isn't specific enough. This is probably the wrong answer people pick the most, because when we're learning about shock, they really like hammering it into us about the PCWP, the systemic vascular resistance, cardiac output, and what the skin might feel like. But even though, yeah, the skin turgor will probably go down and we'd have cold and dry skin maybe, it's just not as useful as heart rate. So like I said, this is not a hard question, but it's just one of those things you want to be careful of because it's easy to get wrong if you overthink the question. I hope you found this video helpful. I'll see you in the next one.